Welcome to another Chats with Children. I hope you're safe and well. Today, I'm delighted to be joined by Dr. Octavia Peck Palmer, who is the current president for the ADLM, which is the Association for Diagnostic and Laboratory Medicine, which was formerly the AACC. And they have their annual conference coming up in Chicago next week, running from July the 28th to August the 1st. So what better person to get a preview of what you can expect at the event next week then talk to the president. So first of all, Octavia, it's lovely to meet you. How are you?
I'm doing great, and thank you for the opportunity to chat with you today.
Well, it's lovely to meet you for the first time. Now, as well as being the president, you do have a day job. So what's your background, or what is your normal role outside of being the president of ADLM?
Yes, so my day job, I am a clinical chemist at the University of Pittsburgh Medical Center in Pittsburgh. And I also am an associate professor of pathology and also the vice chair of health equity, diversity and inclusion in the Department of Pathology. So I have the opportunity every day to do experiments, and those experiments are really ensuring that we can measure important analytes and provide that important information to physicians so that they can manage the health of patients.
Fantastic. Now, I mentioned that ADLM has recently changed its name, but for people not familiar with ADLM, could you give viewers sort of a quick overview of the organization and what its role and vision is really?
Yes, ADLM is a global professional organization that brings together professionals both in the field of laboratory medicine, which includes clinical chemistry, molecular diagnostics, microbiology, and a host of other professionals in the in vitro diagnostics world, all that are working toward better health for all, which is our vision. And one of the things that ADLM provides both members and our customers is a community in which they not only can gain educational resources to aid them in their career development, but it also provides them a networking body of colleagues where they can build out long-lasting collaborations, both in the research and the clinical and educational spaces. And we are a global organization that really works hard at ensuring that our memberships is equipped with the necessary tools to be able to ensure that we are providing the best that we can for patient care.
Right, and as someone who's not had the pleasure of attending previous events, how many people do you normally get? I know it's very difficult because COVID's happened and the pandemic had an impact on numbers, but how many people are you expecting to see attending this year's event?
Well, I'll start with the fact that not only does this event attract over 20,000 individuals, but we also have, as part of this meeting, a ADLM Clinical Expo. And that expo features nearly 900 exhibitors, all showcasing innovative technologies. So it's the premier event. Individuals come to this expo. It's constantly ranked in the trade show Executives Magazine as the Gold 100 Awards. It's recognized as the largest and the most important expo across all fields and industries. And so that's why we attract so many individuals, both members and customers and new individuals learning about the organization, because we are showcasing across technology, services, and solutions for the lab and beyond. Not only how you deliver care, but what tools you can use to provide care.
Right, fantastic. Now, what are some of the key tracks that people can expect to see this year, and what's new? Because obviously trends change all the time. So what are sort of the hot topics that people should be looking out for this year at this year's event?
Yes, and you're correct. Trends do change. However, the goal for us is better health for all, meaning that we want to make sure that we're part of that development of the new technologies. And so we have a stellar lineup of our plenary sessions this year. We start by kicking off our meeting on Sunday with the Wallace H. Coulter Leadership Award winner, and that's Dr. Patrick Boussaint. He's going to speak about the work that he's done, really demonstrating both the need for clinical trials of laboratory testing and how that will actually bolster and ensure health equity. We have other speakers, plenary speakers who are going to talk in areas focused on cancer therapeutics and pharmacogenetics. And that's Dr. Kojo S.J. Alinatoba Johnson, along with Dr. Ron Schreck. We have Dr. Sharon Hiller. She's going to discuss some of the work done in HIV prevention space, really aiming at providing HIV prevention product choices for our medically underserved populations that currently don't have a choice or a voice in what prevention modality that they get offered to them. And then we'll close out our meeting with Dr. Diana Green Foster. She's going to present on sociological and clinical outcomes of individuals who don't have access to basic reproductive rights like abortion. And all of these topics are timely because lab medicine actually touches in each of those areas for patients. I do want to highlight, though, which is very important for the lab medicine field globally, is that this year's meeting, we're going to highlight several sessions, 3, that are going to focus on the FDA's final rule to regulate laboratory developed tests, which are tests that labs develop specifically to ensure that they can meet the needs of their community. They don't sell these tests. They're not medical devices. They're developed within the context with the physicians that are treating the patients. And this is timely because labs now are trying to understand they're now being treated as medical device companies. How do they ensure that their patients still have access to these laboratory developed tests? And what do they need to do to ensure that care does not decline during that time? And so we're going to have experts in the area, not only from our members being there to provide their own insight, but we're going to have representatives from the American Medical Association, the Children's Hospital Association. We're going to have a caregiver and a patient advocate who can give a patient perspective on why laboratory developed tests are so important and timely for diagnosis and treatment. And so we really have a session, a meeting that is going to provide insight and really equip our membership and our other individuals that are really invested in understanding laboratory developed tests. That session will be something they don't want to miss.
Fantastic. Now, you mentioned the exhibition a bit earlier on, and how obviously you've got a lot of exhibitors exhibiting this year, and it's a very popular event. So what are some of the things or technologies that people can expect to see on the show floor? Because I know, having been to many other events in other segments, lab automation, AI, machine learning are all hot topics. So is that similar in this particular space as well?
It is. We are going to feature at the ADLM Clinical Lab Expo once more DXPX US, which is an opportunity for startups and growth stage companies to meet with investors and industry partners for licensing, financing, co-develop merger and acquisition opportunities. With that, we have both very large companies that are showcasing some of their technologies to newer and smaller startup in vitro diagnostic companies. We, in addition, are going to be showcasing, and you talked about artificial intelligence, we're going to be showcasing presentations from winners of our ADLM Fair Lab data analytics competition. And interestingly, these groups utilized informatics, data science, artificial intelligence to identify areas in which care is not being delivered in an equitable manner. And so this competition really challenged participants to develop analytic tools to promote fairness. And one of which we'll see is looking at fairness in peripartum urine drug screening, all of which many of our labs across the country are providing urine drug screening to our patients.
Right, fantastic. Now, you mentioned the exhibition. Obviously, you've got the talks going on in the tracks, but what are some of the other features that people should look out for at the event? And what are you doing to get people interacting and sort of talking to each other?
Oh, yes. more fun things. So, you know, I know I mentioned some of the highlights, some of our biggest highlights with our plenary speakers, but ADLM annual meeting has different subspecialties of lab medicine all coming together. So you're going to see research in the space of clinical chemistry, molecular diagnostics, immunology, microbiology. All of these fields are very well represented in our scientific program. And it really reflects just that, the fact that we fall up under the same umbrella and we're all using laboratory tools to further healthcare. In doing so, we have a poster session that goes on throughout the meeting where you'll be able to see posters both from our trainees, our fellows, along with our residents, with our faculty, and then some of our in vitro diagnostic companies are going to be presenting during those poster sessions. We also have several fun networking events. So we'll have an ice cream social on Tuesday. We're going to have complimentary lunch on Wednesday, a coffee break that's going to be held on a Thursday. And then what I'm excited about is something new, a Labapalooza. It's going to be a puppy park, and that will be all in the exhibit hall on Tuesday and Wednesday. You know, in addition to the science, we also have within ADLM, we have scientific-based divisions in which our members can join these divisions that allow with their expertise and their interest in how they actually practice lab medicine in their own institutions and organizations. And so there'll be separate scientific division activities, ADLM's own Society for Young Clinical Laboratorians, which is a society for our early career professionals. They'll have activities. And then we also have our members only online community, which is the Artery. And so many of our members engage in that online community, again, to share information, to build out networks. So we have a host of activities that are available for all individuals that have an interest in laboratory medicine.
Fantastic. Well, one final question about the actual event. In terms of the event, obviously it's a physical event, people are going to come, and hopefully as many people come and see you in person. How much of the event, though, is available to members digitally, whether they've attended or not attended, so they can access it either during the event or after the event?
So there will be an opportunity that any of our members or attendees that had registered for the meeting, all of that will be available on demand. That viewing starts September the 3rd of 2024, and it goes through July the 31st of 2025. So the plenary sessions, the scientific sessions, all of those recordings are available to those members who had the Chicago All Access Conference registration. Anyone else has the opportunity to go on our website and purchase those for a fee. It really is going to be accessible, whether you are there or afterwards, but we will have that information available digitally, yes.
Fantastic. All right. Now, one question about the association, because obviously we're talking about the event, and the event is obviously the main thing throughout the year that gathers everyone together. But as you said, you are a global association. So for people who are watching this and saying, well, actually, ADLM, that's interesting, I'd like to learn a bit more. Why should people join the ADLM, and what's the benefit of joining that as an organization?
The key thing about joining ADLM is that it does offer you an organizational home. It is your professional home, your educational home, your networking home. And it is because, as I noted earlier, that we have the resources for both education, for both networking, for both research resources to be able to ensure that as you progress throughout your career, that you're fully equipped. And the additional part of that is that ADLM is made up of a breadth of individuals, including individuals who may be in academia, who are also in industry, and who are also may just be in the educational training, which is very important for individuals coming into the field. And there are a host of professional job titles under that umbrella, which span from being a clinical chemist, being a clinical microbiologist, being a biochemical geneticist. All of these professional job titles fall under the umbrella of which ADLM has resources for that individual as they progress through their career. So I welcome anyone that wants to reach out to us online. We are happy to answer any questions via our customer service and to get you involved with ADLM. I'd like to also just add a component to that. Not only do we have ADLM, our conference, every year, but we also have a host of offerings throughout the year. I spoke a little bit about the scientific division. So depending on your expertise and your interests, you can build down and become a member of those divisions. There are a host of webinars that we offer throughout the year that span from, as you noted, artificial intelligence, data analytics, to new technologies in the space, to even training and how does one ensure that their organization or institution is aligned with any regulatory or compliance regulations. So we have a host of offerings throughout the year, and ADLM 2024 is a culmination of bringing everyone together so that we can engage with each other and share as we continue to look to the future.
Fantastic. Well, look, Octavia, it's lovely to meet you. Thank you for giving that overview of both the event and the organisation. I hope it all goes really, really well in the build-up, because I know this is the most stressful period, actually, as you try to make sure all the speakers are lined up and everyone's going to turn up on time and all the other things that you need to do. So good luck with the build-up. Hopefully, I may even see you in Chicago. You never know. I'm still waiting
I hope so.
figure out what I am or not, but we'll see. So there you go, viewers. If you have not signed up yet for ADLM 2024 in Chicago, then click on the link which will be above this video and you can learn more. And if you are, then maybe I might even see you there in person as well. So Octavia, it's lovely to meet you. Good luck with the event. And viewers, thank you for watching. Until next time, as always, stay well and stay safe. Bye-bye.